I think changing healthcare, primary healthcare in Europe is such an important issue because the whole issue about long-term conditions and mental health means that care should be provided outside a hospital setting, and this is an issue across the whole of Europe. So Europe as a whole needs to change. Equally, there are financial pressures, as we've heard today at the summit, across the whole of Europe, and those financial pressures are making people think about where care can be the more appropriately provided in a low care setting, and primary care must be part of that solution. The other aspect is that primary care needs to work in partnership with patients and in partnership with local authorities and local councils to start thinking about health beyond probably the narrow perspective of health that many people often judge it by. And if we're going to really have a healthy society in the 21st century, we need to think about health in a much broader context, and primary care should be at the centre of that. We need to, I think, focus on data. We still have far too much unwarranted variation of the quality of care in primary care, and so good data will help really shine a light on that and help people really challenge each other to improve. I think the reality as well is that some of our practices, general practice in the UK for example, are perhaps operating from too small a size, so I think we might need to see scale, and we're hearing that again today where 15% of the Swedish population receive care in primary care through chains, for example. I can see more of that happening. So I think there's an element of that. I think there's an element as well of primary care needs to embrace the fact that they are going to be responsible to drive population health. So really doing that with their local authorities, for example, is something they need to embrace. And then there's something about embracing the fact that the hospitals aren't the bad guys, which is the way sometimes it's portrayed, and actually for health to improve locally, primary care and secondary care need to embrace each other and work in partnership. The final point would be that this is about really working with patients so that they're absolutely part of the solution, rather than perhaps a more parochial way of care that we've had in the past. I think there are a number of challenges. One of them is ensuring that any policy on health doesn't have perverse incentives. And if you look at healthcare systems across the world, policy is created in a meaningful way with good intention, but often it has perverse incentives. So there's something about really checking and thinking it through to make sure the policy doesn't have that. The second thing for me would be to really align incentives, to make sure that the actions that you want to happen have got the right incentives behind them at the right time. And that would for me mean shifting care outside a hospital setting, so really aligning the primary care incentives, but also incentives for society as well, so that society really embraces the idea that care outside a hospital setting is absolutely appropriate. And the fourth area would be the fact that politics is often in 3, 4, 5 year cycles. Some of this will take longer than 5 years, and therefore we need politicians to be brave and really think about policy that goes beyond 5 and maybe for 10 years, and then stick with it. I think the clinical commissioning groups will have a profound impact on primary care. This is the first time that we've had GPs and primary care clinicians at the heart of decision making for spending the bulk of the NHS spend, and so CCGs are crucial to that. I've also found, working with clinical commissioning groups, that they have a passion for looking at reducing unwarranted variation of care across their practices, and who better to challenge GPs than other GPs to talk about the care that's being provided. So I've got great hope that CCGs can make a difference there. They also understand that if they're really to get the most value from the £100 billion that's spent in England on the NHS, then we have to shift care outside hospital. And so GPs particularly, this is what they're trained for. So I see CCGs as being a really good vehicle for helping that shift take place.